30 countries confirm coronavirus cases. A virus similar to the SARS pathogen has killed hundreds of people and spread around the world since emerging in a market in the central Chinese city of Wuhan. Outside mainland China, there have been more than 150 infections reported in more than 30 countries and regions. The World Health Organization has declared an international emergency over the outbreak. On January 30, the World Health Organization declared the coronavirus outbreak a global public health emergency. Germany, Japan, Vietnam and the United States have reported cases in patients who didn't personally visit China but contracted the virus from someone else who had visited Wuhan, China. These cases of human-to-human transmission are the most worrisome, according to the WHO. Wuhan, the city where the virus originated, is the largest city in central China, with a population of over 11 million people. Following Wuhan lockdown, the city of Wangang was also placed in quarantine, and the city of Ezhou closed its train stations. This means that 18 million people have been placed in isolation. The World Health Organization (WHO) said cutting off a city as large as Wuhan is unprecedented in public health history, and praised China for its incredible commitment to isolate the virus and minimize the spread to other countries. How dangerous is the virus? There are 3 parameters to understand in order to assess the magnitude of the risk posed by this novel coronavirus. Transmission rate (RO), number of newly infected people from a single case. Case fatality rate (CFR), percent of cases that result in death. Determine whether asymptomatic transmission is possible. How contagious is the Wuhan coronavirus? RO. The attack rate or transmissibility, how rapidly the disease spreads, of a virus is indicated by its reproductive number, RO, pronounce R0 or R0, which represents the average number of people to which a single infected person will transmit the virus. WHO estimated, on January 23, RO to be between 1.4 and 2.5. Other studies have estimated a RO between 3.6 and 4.0, and between 2.24 to 3.58. Preliminary studies had estimated RO to be between 1.5 and 3.5. An outbreak with a reproductive number of below 1 will gradually disappear. For comparison, the RO for the common flu is 1.3 and for SARS it was 2.0. Fatality rate, case fatality ratio or CFR, of the Wuhan coronavirus. The novel coronavirus case fatality rate has been estimated at around 2% in the WHO press conference held on January 29, 2020. However, it noted that, without knowing how many were infected, it was too early to be able to put a percentage on the mortality rate figure. A prior estimate had put that number at 3%. Fatality rate can change as a virus can mutate, according to epidemiologists. For comparison, the case fatality rate for SARS was 10%, and for MERS 34%. Who can be infected? People of all ages can be infected by the new coronavirus 2019 nCoV. Older people, and people with pre-existing medical conditions such as asthma, diabetes, heart disease, appear to be more vulnerable to becoming severely ill with the virus. Here are the places that have confirmed cases of the 2019 novel coronavirus. 1. China. As of the 7th of February, 31,161 people have been infected across China, the majority in and around Wuhan. Most of those who have died were in that region, but officials have confirmed multiple deaths elsewhere, including in the capital Beijing. 2 territories outside of mainland China, Macau and Hong Kong, also have confirmed cases. 61 people on board the Diamond Princess cruise ship have the virus. 2. Britain. British health officials have announced that 3 people have tested positive for the virus. 3. Finland. A tourist from Wuhan tested positive for the virus on Wednesday the 29th of January and is being treated in isolation in hospital. 4. France. There are 6 known cases in France, the first European country to be affected. 5. Germany. Germany now has 13 confirmed cases. 6. Italy. There are 3 confirmed cases. 7. Russia. Russia said on the 31st of January that 2 Chinese citizens had tested positive in the country's first cases. 8. Sweden. Sweden has announced its first case on the 31st of January, a woman whose nationality has not been revealed. 9. Spain. 15 patients have been confirmed in Australia. Most of them arrived in the country from Wuhan or Hubei province. 12. Cambodia. Cambodia's health ministry has so far reported one case, a 60-year-old man who arrived from Wuhan. 11. India. Officials confirmed the first case in Kerala, southern India, on Thursday the 30th of January. 2 more cases have been confirmed. 12. Japan. Health authorities have registered 25 cases, including 2 cases of human-to-human transmission. 13. Malaysia. Malaysia has confirmed 15 cases so far. 14. Nepal. Nepal has reported 1 case so far, a man who arrived from Wuhan. 15. Philippines. The Philippines has reported 3 cases of the virus, including 1 death. 16. Singapore. Singapore has 33 confirmed cases. 17. South Korea. South Korea has confirmed 24 cases of the virus. 18. Sri Lanka. Sri Lanka has confirmed 1 case, a 43-year-old Chinese tourist from Hubei province. 19. Taiwan. Taiwan has uncovered 16 cases so far, including 2 female Chinese nationals in their 70s who arrived in the country as part of a tour group. 20. Thailand. Thailand has announced 25 confirmed infections. 21. Vietnam. Vietnam has 10 confirmed cases. 22. Canada. Canada has confirmed 5 cases so far. 23. United States of America. The U.S. has confirmed 12 cases. 24. United Arab Emirates UAE health officials said Wednesday a Chinese family of 4 had all tested positive for the virus after arriving from Wuhan several days ago. There are now 5 confirmed cases in the UAE. These are just a few of the confirmed cases among others. Kindly subscribe to our channel for more videos.